Antiemetics yesterday, right? One second. Okay, fine. And yesterday we have discussed about the 5-HT3 antagonists. We have discussed the indications, we have discussed the dose effects and the mechanism. Now, next one is something like prokinetic agents. Basically, prokinetic agents are those which hasten or facilitate the GI movement. Okay, so hasten the gastric emptying. Usually, it fastens the gastric emptying. So, most of these drugs have an additional antiemetic effect because these drugs are basically interact with the 5-HT receptors or the dopamine receptors. So, all of you know that there are dopamine receptors in the chemoreceptor trigger zone. So, these dopamine receptors blockade definitely can reduce the tendency for emesis. As I told you, drugs which promote GI transit and gastric emptying increase coordinated propulsive motility, basically known as prokinetic agent. So we have various drugs under this, and metoclopramide is one of the most widely used drug. In fact, it's a very commonly used drug. This is actually chemically related to prokineamide. I hope you know prokineamide. I don't know whether or no. I think prokineamide is you haven't discussed those topic. It's actually a part of a local anesthetic. Prokineamide only chemically. Okay. But pharmacology, it is not at all it is not at all related to local anesthetics. Now, it has different actions, how it exerts its antiemetic as well as prokinetic effect. It has increased gastric peristaltic movement. It's a property, increase the gastric peristaltic movement. Then relax the pylorus part of the stomach and the first part of the duodenum. All right. So, as I told you, all these steps speeds the gastric emptying. Of course, the prokinetic agents are the agents which fasten the gastric and intestinal motility. All right. In the brain, it blocks D2 receptor. I already told you, it blocks the dopamine 2 receptors. And the details of the dopamine receptors shall discuss when we discuss about the central nervous system. So, there are 5 subtypes, D1, D2, D3, D4, D5. And in the brain, D2 receptors are blocked by these drugs, especially metoclopramide. Where in the brain, it's mainly CTZ. And I told you yesterday that it's devoid of blood-brain barrier. So, I told you that even those which lipid insoluble drugs which can access into CTZ and exert its antiemetic or emetic effect. All right. Then third one has D2 blockade. I told you D2 blockade and 5-HT4 agonistic action and 5-HT3 antagonistic. So, I told you dopamine blockade as well as 5-HT3 blockade, both. The dopamine blockade and 5-HT3 blockade can contribute its antiemetic action. All right. And 5-HT4 action can hasten the gastrointestinal motility. Okay. Because 5-HT4 agonistic action indirectly increase the ACH, that is acetylcholine secretion. And you know that you have studied the role of ACH in the intestine when we discuss about the autonomic nervous system. There it can increase the intestinal motility. The contraction of the intestine increase. So definitely the pulsatile motility of the intestine can be increased. All right. So please remember, it has 3 distinct mechanisms. One is blocking the dopamine receptors, especially the D2 receptor, and 5-HT3 receptors. Definitely these 2 actions can contribute its antiemetic effect. Okay, I hope you're following. Then definitely D2 blockade also can indirectly increase the intestinal motility. So please remember these 2 mechanisms, D2 and 5-HT3 receptor blockade, are mainly contributing the antiemetic effect, and 5-HT4 agonistic action is mainly contributing its prokinetic effect. Okay, when you talk about pharmacokinetic action, all these drugs are, especially we are talking about the metoclopramide. So this can be given orally and absorbed orally, and it can cross blood-brain barrier, and even it can secrete into breast milk. And in metabolism, basically it is conjugated in liver and metabolized and excreted via. There is a mistake in the slide. It metabolized and excreted via urine. Okay, 3 to 6 hours is a normal T off, hasten the absorption of aspirin diazepam because it hasten the gastric emptying time. All right, so that is the reason why it increases the absorption of aspirin and diazepam. Whereas since gastric emptying time is less, digoxin absorption is generally decreased. Digoxin is something which is cardiac glycosides used in congestive cardiac failure and many other cardiac issues. Now, what are the uses? We have discussed the uses of ondansetron and its congeners in detail. So, what are the uses of metoclopramide? This is a popular and effective agent for post-operative drug-induced and disease-associated vomiting. Okay, and many conditions. When we discuss about the migraine, we had discussed that migraine, many people, migraine can induce emesis. Okay, so in fact, metoclopramide was used as an antiemetic drug in migraine-associated emesis, and we have seen some of the drugs which can induce emesis, especially opioids can induce, anti-Parkinsonians and levodopa can induce emesis. So such drugs can induce emesis. So definitely these drugs may have a beneficial role in the treatment. Yesterday I told you that the vestibular, the brain pathway is actually cholinergic. So basically these drugs are not useful in these circumstances. Which circumstances? Motion sickness. That we'll discuss in detail. The motion sickness part, the treatment of motion sickness we'll discuss later. And this is one of the widely used drugs, especially after the 5-HT3 blocker. This is one of the most widely used drug agent for the chemotherapeutic induced vomiting. So we have seen that when we discuss about the chemotherapy, cancer chemotherapy, we have told that these drugs can induce emesis. All right. And told you that it is a gastrokinetic or the prokinetic agent. So this is useful during emergency general anesthesia, especially in accident cases or where emergency surgery is required and general anesthesia is required. So for the gastric emptying, faster gastric emptying, freeing the gastric bowel, it can use this drug to relieve post-vagotomy dumping syndrome. So vagotomy can lead to dumping syndrome. And diabetic gastroparesis, associated gastric stasis. So this is also used in this chronic diabetic condition, gastroparesis, where it can used as a prokinetic agent. So you can classify the two different uses of metoclopramide as antiemetic, as prokinetic agent. So please remember this. Okay. Now when you talk about ADR, I think you can guess some of the adverse effects. Being a dopamine antagonist, definitely some of the extrapyramidal side effects. So you know that dopamine deficiency generally leads to Parkinson's-like syndrome. And here we are blocking the dopamine receptor, especially D2 receptors in the brain, including basal ganglia, substantia nigra, okay, all this neostrigal pathway. So there the deficiency of dopamine due to blockade eventually leads to something called extrapyramidal side effect, like rigidity, tremor, mask-like face, ataxia, and all those. Loss of gait. When you walk, you will feel that the person is falling towards the gravity. So that is something like extrapyramidal side effects that you can anticipate. What are the others? Sedation, dizziness, loose stools, muscle dystonia, especially in acute muscle dystonia in children. This is actually not dose dependent. Some children may precipitate muscle dystonia with the first dose itself. Okay, so please remember that. Extrapyramidal side effects. EPS stands for extrapyramidal side effects. Galactoria. I hope you know why galactoria is precipitator here. Because the reason is that dopamine is having an anti, like dopamine block the release of prolactin. Okay. So when you block the dopamine, it can increase the prolactin secretion. So galactoria, prolactin, due to the increased prolactin level, hyperprolactinemia can be there. Okay. So the lactation in females or increase, gynecomastia in males due to the increased prolactin level. Pregnancy as such, no harmful effects, but it is not often used as a drug of choice for the morning sickness. We have seen that morning sickness yesterday. Another congener is Domperidone. It's also a prokinetic agent, but there are some differences. This is actually a dopamine blocker, pure dopamine blocker, chemically related to haloperidol. It's a neuropsychiatric agent. It is a neuroleptic agent used in psychosis and other conditions like schizophrenia and all. You will discuss in detail later. Okay, so please remember, it's chemically related to such a neuroleptic agent. It has only, I told you that only D2 receptor antagonistic action, only D2, no 5-HT4 agonistic action, no 5-HT3 antagonistic action. Okay, and the one more difference from how it is differ from metoclopramide is that it poorly cross blood-brain barrier. And when you talk about the metoclopramide, I told you that it can cross blood-brain barrier, and that was the reason it exerts extrapyramidal side effects. And therefore, like this is poorly crossed blood-brain barrier. Therefore, here the extrapyramidal side effects, incidence of extrapyramidal side effects are less. All right. So here you can also add one more point. Like usually, in many people, emesis are noticed, especially in early period of anti-Parkinsonism treatment, especially with the levodopa. Levodopa can cross blood-brain barrier and convert into dopamine, and this dopamine can stimulate the dopamine receptors in the CTZ and induce emesis. So such emesis can be encountered by domperidone because it won't cross blood-brain barrier. So you don't use metoclopramide because metoclopramide can cross blood-brain barrier, and what happens? It can encounter the dopamine action. Okay. Then you know that this is a dopamine antagonist, and the antiemetic action is mainly due to the blocking these D2 receptors in the CTZ. So please remember that. As far as the pharmacokinetics is concerned, oral bioavailability is only 15% because it undergo high first pass metabolism. I hope you remember the term first pass metabolism. So please try to recollect. I don't want to tell what is first pass metabolism. You have discussed in detail about the first pass metabolism. And the dry mouths, loose stools and galactorrhea, though it won't cross blood-brain barrier, galactorrhea have noticed, but very minimum compared to metoclopramide. Okay, same indication as metoclopramide, but less effective because the metoclopramide has additional effects like 5-HT4 agonistic action and 5-HT3 antagonistic action. This is only having dopamine action. Okay, so the action is inferior compared to the metoclopramide. It is having an inferior effect. Now we are talking about other dopamine receptor antagonists. So though these drugs, what we have discussed, metoclopramide and domperidone, is having dopamine blocking activities, it is not considered as a pure dopamine antagonist because it is generally classified as a prokinetic agent. So this can be considered as a third group of drug. First one was 5-HT3 blockers. Second one is prokinetic agents, and the third one is dopamine receptor antagonists. See, these drugs are basically, most of these drugs are used as psychotic agents, especially used in psychosis like schizophrenia and all. These are pure dopamine antagonists. So generally these are used as schizophrenic agents. Okay, this their principal mechanism action is dopamine 2 receptor blocker at CTZ. It not only block the CTZ dopamine receptor, it can also block the dopamine 2 receptors wherever in the brain because it can cross blood-brain barrier. So please remember, it can cross blood-brain barrier, and these drugs are not appear to be as uniformly effective as cancer chemotherapy. This is actually as a reserve drug, used as a reserve drug nowadays, where these first-line drugs like ondansetron, its congeners, or metoclopramide are not useful. Then only you may think about these drugs. These are the drugs used as a add-on drug in refractory cases. Okay, and not very effective in cancer chemotherapy-induced emesis. And of course, problem is it has or extrapyramidal side effects, and it also has got antihistaminic and anticholinergic activities. Some of them has got. Next, fourth group is antihistamines. The fourth group is antihistamine. When we discuss about the antihistaminics, I don't know whether you remember that The first generation and second generation antihistaminics were there. First generation includes these promethazine, then we have chlorpheniramine, those drugs basically having high sedative property because it can cross blood-brain barrier, and there it has also got anticholinergic. So some of these antiemetic properties are due to its sedative and anticholinergic properties. So we'll see. H1 antagonists are primarily useful for motion sickness and postoperative emesis. See, I told you that anticholinergic pathway from vestibular apparatus to the brain, especially to the CTZ, and from there to the higher center of emesis. It is cholinergic pathway. So blocking this with anticholinergic drugs are quite effective. So it is useful in motion sickness, and these drugs act on vestibular afferents and within the brainstem. I told you that vestibular afferent is having a cholinergic pathway. Cyclizine, hydroxyzine, promethazine, and diphenhydramine are examples of these class of agents. So please remember, none of the second generation drugs like cetirizine, levocetirizine, fexofenadine, all these drugs are not at all useful because it cannot cross blood-brain barrier. First of all, these drugs need to cross blood-brain barrier for this effect to act in the pathway, vestibular pathway. So these drugs means the second generation drugs like cetirizines are free. Like it cannot cross blood-brain barrier. So it is not at all useful for this antiemetic purpose. And please remember, only the first generation drugs are useful. Examples are given here: cyclizine, hydroxyzine, promethazine. All right, and of course diphenhydramine. These drugs are useful in two conditions. One is as drugs for motion sickness, okay, especially, and seasickness also, right? And these drugs, one more drug is there. That drug is called. Okay, some of the drugs, one of the antihistaminics, doxylamine, DOXYLAMINE. Doxylamine is another first generation antihistaminic. It's very effective in morning sickness. Morning sickness, we have been discussing about morning sickness, and doxylamine with the, our vitamin B, which is which vitamin B is that? Pyridoxine. Okay, pyridoxine, doxylamine combination is very effective and safer drug. In fact, the safest antiemetic drug for the morning sickness. So please remember, please add doxylamine to this group. So all these things we have discussed. Now other anticholinergic drugs, when we discussed about anticholinergics, hyoscine and scopolamine, hyoscine is the other name of scopolamine. We discussed in detail about it's a natural alkaloid. Okay, Atropa, belladonna was there, then Niagara, Datura stromantia was there. So this is one active principle from the alkaloids, and this is widely used as a anti-motion sickness drug. So this scopolamine injections are available, oral tablets are available, and also the patches are also available. Patches, basically all these drugs should be given prior to the commencement of the journey. See, once the emesis have started, there is no point of using these drugs, whether it is antihistaminics or the anticholinergic drugs. So I told you that though we are using antihistaminics, we are exploring the anticholinergic property. Okay, anticholinergic property. And now this is scopolamine. It's a direct anticholinergic drugs. It can directly inhibit the pathway from vestibular apparatus to the brainstem due to its anticholinergic property. So these drugs, whether it is antihistaminics or anticholinergic, these drugs have to be used at least half an hour prior to the commencement of the journey, because once the journey has started and patient started to vomit, there is no point of taking this medicine, because it is something like we have to take prior to the commencement of the journey. So like orally maybe 45 minutes to 1 hour before the commencement of the journey. Injection maybe half an hour. Okay. Hydrobromide, but usually administered as the free base in the form of transdermal patches. All things we have discussed. Nausea postoperative. Okay. Anticholinergic agents have no role in the chemotherapy induced. So please remember, these drugs have no role in any other forms of emesis, chemotherapy or drug induced anything. As far as the antihistaminics are concerned, It is also useful in the morning sickness. Doxylamine, I told you, pyridoxine combination, all right. And apart from that, it is all used in the motion sickness. Now, we're talking about some reserved drugs. No, I don't say that it's a reserved drugs. It's all drugs are refractory from the drugs. Neurokine receptor, NK1 receptor antagonists. Substance P receptor, okay. So, aprepitant and fosaprepitant. These are the two drugs, parental formulations, which is having anti-emetic effects and in delayed nausea and improve the efficacy of standard anti-emetic regimes in patients receiving multiple cycles of chemotherapy. See, many of these cancer chemotherapeutic agents are known to produce severe emesis. Sometimes what happens, our routinely used 5-HT3 antagonists. Which are the 5-HT3 antagonists? Just try to recollect. Okay. And also the prokinetic agents may not be sufficient. That cannot arrest the emesis. So, in such cases, aprepitant and fosaprepitant, it's only the parental formulations are available. It is neurokine 1 receptor antagonist. Okay. Substance P is the agonist on the neurokine receptor. Cisplatin, you have seen the cisplatin. When we discuss about cisplatin, I told you, in fact, we had a question, MCQ question, that cisplatin is having vomiting as one of the important adverse effects. Aprepitant is bound extensively to plasma protein, more than 95%, metabolized by CYP3A4, and it is excreted to stools 9 to 13 hours of the T off. 125 milligram capsules is available. Okay. Other than the parental formulation, it's also available as the then cannabinoids. I hope all of you are very familiar about cannabinoids. Ganja, marijuana, hashish, bhang, all this belongs to cannabinoids. So these formulations are also having some of the pharmacological. Okay. We have dronabinol. It's actually a derivative. Okay, marinol. It's a naturally occurring cannabinoid derivative that can be synthesized chemically or extracted from the marijuana plant, cannabis sativa. കഞ്ചാവ് ചെടിയുടെ ശാസ്ത്രീയ നാമമാണ് കാനബിസ് സറ്റൈവ. നിങ്ങൾ കണ്ടിട്ടില്ലെങ്കിൽ ഗൂഗിൾ ഇമേജിൽ നോക്കിയാൽ മതി. പലപ്പോഴും നമ്മൾ വാർത്തകളൊക്കെ കേൾക്കാറുണ്ട്, പലരും ഇത് വളർത്തുന്നത് വീട്ടിൽ. പക്ഷേ പ്രശ്നം എന്താ വെച്ചാൽ ഇത് പൂത്ത് കഴിഞ്ഞാൽ ഭയങ്കര സ്മെല്ലായിരിക്കും. ഓക്കെ. നാബിലോൺ ഇറ്റ്സ് എ കഞ്ചനർ ഓഫ് dronabinol, synthetic cannabinoids. Okay. Now, what are the this can it can stimulate the, not blocker, it is a stimulant of cannabinoid 1, CB1, CB2 receptors are it stimulates the CB1 subtype of the cannabinoid receptors, and which is mainly present in the vomiting center. That is the mechanism. Okay, I'm talking about the mechanism. Rapid onset of action, and the action in 1 hour. Extensive first pass metabolism is there. And what are the uses? Mainly used in prophylactic agent in patients receiving cancer chemotherapy. Again, this is a reserved drug. Okay, see, suppose the patient is not, we are not able to arresting the hyperemesis, and it can stimulate appetite. See, കഞ്ചാവ് വലിക്കുന്ന ആളുകൾക്ക് ഭയങ്കര വിശപ്പുണ്ടാവും. അപ്പോൾ അതിന് കാരണം ഇറ്റ് സ്റ്റിമുലേറ്റ് അപ്പറ്റൈറ്റ് ആണ്. ആൻഡ് വാട്ട് ആർ ദ അഡ്വേഴ്സ് എഫക്ട്സ്? സെൻട്രൽ സിമ്പത്തോമിമെറ്റിക് ആക്ഷൻ. മരിജുവാന സാധാരണ ഡിപ്പെൻഡൻസ് ഉണ്ടാക്കും. ഓക്കെ, എസ്പെഷ്യലി സൈക്കോളജിക്കൽ ഡിപ്പെൻഡൻസസ്. സോ ഈ പേഴ്സണാലിറ്റി ഡിസോർഡേഴ്സ്, മെൻ്റലി അൺസ്റ്റേബിളായ ആളുകൾക്കൊക്കെ ഇത് യൂസ് ചെയ്യുമ്പോൾ വി നീഡ് എ സൂപ്പർവിഷൻ. Very commonly, very rarely in severe hyperemesis, corticosteroids may be used, and some of the that inflammation, chronic inflammation sometimes invite emesis, so dexamethasone may be used. Just remember that name. Okay. Benzodiazepines, lorazepam, and are not very effective antiemetics, but the sedative, amnesic, and anti-anxiety effects can be helpful in reducing the ആൻറ്റിസിപ്പേറ്ററി കമ്പോണൻറ്റ് ഓഫ് ദി നോസിയ ആൻഡ് വോമിറ്റിംഗ് ഇൻ പേഷ്യൻസ്. അതായത് ചില പേഷ്യൻസിന് ആൻറ്റിസിപ്പേറ്ററി ചില കാര്യങ്ങൾ നമ്മൾ അബ്നോക്ഷ്യസ് ഇവൻസോ റീകോളിംഗ് ദി അബ്നോക്ഷ്യസ് ഇവൻറ്റ്സ് അല്ലെങ്കിൽ സ്മെല്ല്, അതൊക്കെ ഒഴിവാക്കാൻ ആംനീസിക് അല്ലെങ്കിൽ സെഡേറ്റീവ് എഫക്റ്റ് ഓഫ് ദി ബെൻസോഡൈസപ്പിൻസ്, എസ്പെഷ്യലി ലോറാസെപ്പം ആൻഡ് അൽപ്രസോള, മേ ബി യൂസ്ഫുൾ. സോ thank you. We have just stopped the, we have just finished the class of antiemetic within two sessions. We have we will update you with the MCQs. All right. Fine. And now from here on, we'll try to upload the classes in YouTube. We'll see what can be done. I think this interaction is much better. Though it is not a two-way interaction, at least you can follow the slides along with the voice narration. And if you have any feedback regarding this, please let us know. And now from here onwards, we'll continue the classes with a full-fledged manner. All right. Thank you. Thank you for your patience. Stay safe. Stay home. Okay. Thank you.